Morning, guys. I'll stand here. Hello, everybody. Welcome to what should be a wonderful event around diversity, equity, and inclusion, in particular in the health space. I'm Margo Edelman. I'm the Deputy GM of the New York office. Very excited to welcome you all to the New York office today. I know many of you are part of this office. Many of you guys are on the Edelman Health team, really from around the network, who come in for your couple of days of meetings. So welcome to that team. And big welcome to our panelists, and then to Amira, who's going to be our moderator for today. And then also big welcome to, I think, the 150 people who are joining us on Zoom. So you guys all for making time. And with that, I'm going to turn it over to Amira to introduce our panelists and herself. There you go.
Thank you, Margo. Welcome to everyone joining us on Zoom. Hello, we're glad you're with us. Everyone here in the room. We'll have more friends trickling in, but I'm Amira Marger. I lead our DEI practice within our health sector here at Edelman, and I'm based out of San Francisco, so it's really nice to be here. It's much sunnier here than it was in the city of San Francisco today. So thank you for bringing the good weather for me and our panelists. Before we get started, I'm going to let our panelists introduce themselves because I think it'll be best for you to hear from them the greatness and power that they bring every day as they add value to the world of health. But housekeeping, for those of you joining us virtually, there is a link that will be popped into the chat with the bios for our panelists who are joining us today. And we will be monitoring the chat for questions. We are going to have a robust Q&A. No one likes these conversations to end without a chance to ask more than one or two questions. So my friends in the back will keep me honest. But as we get started here, I'm going to refer to our panelists as informed guides. I know our signage and our invites said experts, but even myself, I refer to myself as a guide because all of us are always learning, evolving, and changing our behaviors based on new information we receive and consume. That's part of the conversation that we're going to have today around health equity. So before I give a baseline of what brings us here today and the information we're going to use to have this conversation, I'm actually going to ask our first informed guide, Dr. Tamika Fairley, who's joining us virtually. Hi, Dr. Fairley. Will you give us the 90 seconds on how you bring your power and greatness to the world each day?
Hi, thank you, Amira. And thank you for inviting me to this panel. I'm really excited to be here with you all. I know it's going to be a wonderful conversation with all of us here. And so my name is Tamika Fairley. I am the Assistant Director for Health Equity and Health Communication at the White House in the Office of Science and Technology Policy. I work in the Health and Life Science Group. And so part of my job really is to bring health equity to the table when we're talking about the policies around science, whether that's, what are we thinking about in terms of climate and environment, health and health medical technology, just a variety of areas. But there are a few of us here whose job it is to pay close attention, raise our voices, and try to make sure that what we're doing here in terms of policy is equitable. I am here on loan from the Centers for Disease Control and Prevention, where most of my work is around breast cancer or early onset breast cancer. And a good portion of that work, given the target audience, has to do with minority and underserved women, mostly because they are at a higher risk for developing breast cancer under the age of 40. And, how do I show up in this space aside from those things? I think everywhere that I am in every space that I have an opportunity to raise my voice, I try to do so and make sure that we are really thinking about, in the spaces that I operate, making sure that what we're doing is being done in an equitable way, and assuring that we are listening to the voices of people for whom we are trying to help and provide services to in the federal government.
Thank you, Dr. Fairley. Appreciate you being here with us this evening. And Dr. Hewitt, will you introduce yourself?
Sure, Mary, thank you and Edelman Health for having me. My name is Amber Hewitt. I'm a counseling psychologist by training, currently I serve as the Chief Equity Officer of the District of Columbia Government, and Director of the Mayor's Office of Racial Equity. Started my career on tenure track, took a risk, moved to Washington, D.C. 6 years ago. I resigned from my tenure track job for a 1-year fellowship on Capitol Hill. Didn't know what I was getting into, but I love the interplay of equity policy, a little bit of politics. So I think throughout my varied careers, starting on the tenure track, working on the Hill, working the federal executive branch, working as a director of health equity, a child health care lobbyist, now working in local government. I would say the common thread of all of those professional roles is social justice. So I bring that lens. And I often say that we aren't just working for District of Columbia residents, working with residents. So I think it's important when we're talking about health equity and health inequities that we aren't viewing communities from a deficit model, really understanding what are the strengths and assets that we can tap into within communities, and how can we prioritize those lived experiences into the
Dr. Brown.
Thank you. Good evening, everyone, and thank you so much for the invitation. Such a pleasure to be with you this evening. Carrie Mitchell-Brown, and I am the founder and architect and equity strategist of KMB. It's a boutique firm really partnering with organizations and leaders who are looking to take up race in very different ways, and take it head on, specifically anti-Black racism. And working with those organizations, not just those in name, but also in deed. I also serve as the Senior Vice President for Finance and Operations at Race Forward, and there I'm really focused on creating a blueprint for operationalizing and practicing making dark-skinned the girl. Beyond tactics, beyond emotional decisions, and beyond crisis response. I do that by inviting people in, not shaming, not blaming, and being on the journey for learning together. Great pleasure. Thank you.
Hi, everyone. My name is Hope Kidding. I'm a reporter with Axios. I cover business day to day. My professional career though started on the other side. I was actually working in business. I was on Wall Street for a number of years in product management and business development. And I switched careers because news was really something that I was passionate about and just in earlier on in my career. Even though I cover business and those are the big B, I cover everything from Netflix to what's happening, the Fed. I think like a lot of journalists of color over the last couple of years, we have found our voice and found the need to speak out against things that we see as being as injustices. And I think it's really wonderful to be able to expand my own reporting to cover things that I think we've all felt in our communities on a personal level, but now having enough of that support, globally to be able to write those. And so I've expanded into the intersection also of where communities and companies are failing to address some of the issues that we've all known about, and just now be able to speak out and speak plainly about the issues is something that I care very deeply about. And I'm honored to be part of this panel. Usually the one asking questions, I'll do my best to try to answer questions. But yeah, just thank you for having me.
Thank you, Aaron. Dr. Gray, welcome.
Thank you, Amira, and thank you to all of you for the platform. Daryl Gray. I had the pleasure of being a man of faith, a husband of 12 years, father to 4 amazing kids. I'm a physician by training, gastroenterologist. I don't know if anybody in here has ever had a colonoscopy, but that would be me. Public health practitioner, community activist, and I also have the pleasure of serving as Chief Health Equity Officer at Elevance Health. So Elevance is, you may recognize their prior name, which was Anthem. We are a large health company. We serve about 45+ million members across the nation. We have nearly 100,000 associates. And really what we're trying to do is elevate whole health and advance health beyond healthcare. And I get to serve as the Chief Health Equity Officer and advance health for everyone. So pretty exciting.
Wonderful. Thank you all for being here, and let's just pause for a moment and bask in the awesomeness that is. Thank you for your time and your talents truly for being here with us and sharing the work that you're doing. I think it was in our prep call, Dr. Gray said you're gonna have to reel us in. So I'm gonna do a little bit of reeling, but it's because these are the people who are in the trenches, right? Sleeves rolled up who are advancing equity and working in health equity. They are doing the work, and so they're gonna build on top one another's answers here. I'll do a little bit of reeling, but I'm also going to let go off rails a tiny bit because sometimes that's where the best nuggets and conversation come from. And a reminder to everyone, this is an inaugural series. This is our first DEI Beyond the Blueprint event, and we are excited to bring together voices, as you see, health, DEI, media, and storytelling to talk about ways that we can help one another. This event conversation is for all of us to expand our knowledge base and hear different perspectives on the work that's happening across workplace culture, DEI, health equity. And we talk so much about the what. I know many of you are communication practitioners, so we shape problems and challenges. So we know the what, we know that there's a problem, but how do we get to that detailed how? You know, people want to know what are the action steps that we take to actually advance equity and to impact the experiences of employees, and consumers, people, the humans every day who rely on the work that we do in the workplace. So that's part of the conversation we're going to have today. And while Edelman's health sector is hosting this event, we intentionally spread the invite wide and far. Like I said, there's different industry represented on the panel, and those of you here in the room and those of you virtually joining us, because we can learn from the tactics, we can learn from the opportunities and the strengths of how people are advancing equity in different sectors, even beyond health. So we thank you for being here with us, and we believe the conversation is going to be relevant for everyone here, regardless of whether or not you're specifically in the health space. And the truth is, I was scrolling through LinkedIn and I saw this as another thought leader, so don't quote me, I'm not the first to say it, but every business is in the healthcare business. Right? If you employ people, human beings, you are about health. The health and well-being of your people is directly tied to your success. And I think that's so apropos for the panelists we have here today and what's happening in and across the world. We at Edelman do a survey every year called the Trust Barometer. And we found that 78% of employees say that they expect that their employer will have a meaningful impact on their health. And that can look like many things: a healthy office environment, mental health supportive programs to guard against burnout, health incentives, and more health programs. So the basis for our conversation tonight that our panelists got the links and the share outs to is the Trust Barometer. Trust in health and trust in the workplace are two special cuts of the trust study that we did this year, because we wanted to understand what is the employee experience, particularly in the midst of the pandemic, and how has that impacted the way that employees are engaging with their employer? And when it comes to trust and health, how are we influencing the behaviors that each of us choose to participate in based on the information that we receive and that we consume? That's part of what we're going to talk about today with our panelists. And so the first question I have is for Hope. Actually, Hope, we are coming up to the 3rd anniversary of the declaration of the COVID-19 pandemic, and the infodemic we've all heard of has impacted health access, health outcomes, particularly for marginalized and historically excluded communities. And you help shape stories and narratives in your work. And I'm curious how you see journalists being able to use narrative and storytelling to think about the ways we reach those communities who are impacted in the midst of now and future crises.
Yeah, it's hard to believe that it's almost 3 years. That sounds like such a long time. And yet it also feels like a short amount of time. But I love the word that you used, infodemic, because I feel, and I'm sure on the receiving end of news, it's all a lot. I'm not here to share it's hard the last 3 years, but it has been to keep on top of everything, make sure that the public is aware of all the changes in mass guidance on vaccines. And so I think one of the things that our industry has learned is really to be really focused in how often we're writing the stories, who and the angles that we're taking. So health equity has been a really big part of our coverage because we know that communities are receiving information in disproportionate ways. There's different levels of trust, as the trust barometer has shown. And so, as I mentioned, as more journalists of color kind of found their voice, we have felt more empowered inside the newsroom to raise our hands and say, look, we really need a story on the misinformation that's happening with Spanish language news and social media. For example, we are seeing, especially in Asian communities, there's a language barrier, and so we've been covering the fact that a lot of community leaders have had to go out and translate our stories or put up posters to get that news out. So I think as we all know, everything is systematic, and so inside our system of news, there's just been a lot more of that intentionality and awareness to be specific in our coverage, because we know that every audience, lives in different places. Some are more on Twitter, or some are more, again, in on Facebook, and being able to, target those stories specifically to our audience, I think has been one huge learning from the past 3 years.
Much hope. And you mentioned systemic or systematic, and Dr. Brown, you said you're a cultural architect, and oftentimes as a DI practitioner, we're talking about shifting systems, right? Policies, practices, behaviors, beliefs. I'd love to hear from your perspective as you're counseling these amazing companies. I think SEIU, Dartmouth, the Walt Disney Company, some that you've worked with. How can we embed trust in the way that we're helping companies, organizations think more about cultural architecture?
Sure. It sounds simple. It's also challenging. And it's simple. Paying attention to people's basic human needs, like reconnecting with humanity, right? Employees in the workforce expect for organization to be discrimination-free zones. Oftentimes that's not the experience, but it is the hope, the desire, and the expectation. We spend most of our time at work, now remote, or in the office. And if you can pay attention to the culture in the beginning as it relates to creating a sense of belonging where everyone feels as if they belong and that all contributions are valued, that there are high levels of respect, basic human needs, right? Reconnecting with people's humanity. Also holding that white is not always right and Black is not always right. And so is there a possibility to create a system or an ethics of disagreement and difference? And so people can take things head on, have a discussion. And I've learned, and within practice and evidence, that if you pay attention to these things in the beginning, then you'll have fewer casualties along the way. Or more importantly, you can't predict what those casualties or who those casualties may be by gender or group. And oftentimes we'll hear for group within organizations, well, we can't seem to maintain Black women within this organization. As if it's a problem with Black women and not the organization. Or we can't seem to maintain younger or millennials within, our culture. They just don't fit or work here. Well, is it the millennials or is it the culture? Right. And so really being able to create a practice or process of naming it, understanding and understand why. We often talk about inclusion with the failure to address who has been excluded and why. So sounds easy. And it is, if it's given the right intention and attention. Because it's really meeting what their basic human needs.
Reminds me of something Ibram Kendi says, identify it, describe it, and dismantle it. Mention acknowledgement as a piece. What is the issue here?
And take an action.
Action.
And not
Yes.
just individual action, collective action, right? So it took all of us in this room to work towards creating that sense of belonging. It's certainly a lot more impactful than one or two people doing it, especially those who are addressing it because they feel like they don't belong or their contributions do not matter or that there's high levels of disrespect. That's too much work on any one individual, especially those who are negatively impacted. And at the end of the day, a culture where we don't have that doesn't work for anyone, not long term, because you don't get the full value and the benefit of the human potential that lies within that culture or
Mention basic human needs. And as a DI practitioner, many of my colleagues will often say, equity is about specificity because we don't all require the same needs to be met, resources, the same support systems, right? We all have different needs based on our experience, our geography, our zip code. And Dr. Hewitt, you have a lot of experience standing up health equity initiatives to really help meet people's needs in the health sector. And you've done it through strategic community partnerships and community level advocacy, right? In the trenches with people who are actually impacted. And I'm curious if you can tell us more about what does that community level advocacy and advancement of equity look like when you think about changing policies and actually meeting those human.
Thank you for that question. And one thing I left out of my introduction that I'm here in my personal capacity, so I'm not representing the District of Columbia government or the mayor of the city.
Thank you for clarifying.
I just wanted to mention that, but I do bring all of those perspectives to bear, or at least hope to. But to answer the question, I first want to just share some key terminology that I think really highlights that question around what we mean by equity or racial equity and what we mean by meaningful community engagement. So in my work, we're focused on racial equities. We are race explicit, not race exclusive. We lead with race, but we don't end with race. I'm so excited sitting next to Dr. Brown. You guys done this work extensively. But when we define racial equity, it's both a process and an outcome. I think sometimes it's easier for us to focus on the outcome where we will know when we have achieved health equity or racial equity, when race, ethnicity, or other demographic factors no longer predict opportunities, outcomes, or the distribution of resources. But it's a process. It's a process of meaningfully involving those who are most impacted by our policies, programs, and services into the design, implementation, and evaluation of programs. And one way that we can do that is looking at this through an evidence-based theory of change. So part of that theory of change is what we're doing now, normalizing conversations around equity and racial equity and health equity. That second part is building capacities. We can't do this work within our silos. It's a whole of organization approach. I usually say whole of government approach when I'm wearing my other hat. So we know that we have to partner with communities. We have to understand the needs, values, assets, those inherent strengths that live within communities. And when we're engaging communities, bringing those perspectives in that engagement. I think another important piece is thinking about key principles of meaningful community engagement. And some of those key pieces are engaging with cultural humility. And it's not always the onus on the community to educate us about their cultural values. It's also understanding our positional power. So when we're engaging in communities, how are we showing up? I have to remind myself, I'm not just Amber from Shreveport, Louisiana, walking in a room. People don't really perceive me in that way when I'm wearing other hats. I have to be aware what harm or harms my organization have contributed to that particular community that may be in the hearts of none. So cultural humility, positional power, and power sharing, understanding racial and historical trauma, as well as using credible messengers. So those are some key principles when it comes to really leveraging the strengths of community. And I think that's the distinction between equity and inequality, because it recognizes where people are, but it also really recognizes the strength and values that we can sort of tap into to create the most effective health equity solutions.
Credible messengers, trusted messengers. And Dr. Gray, this question's for you. The patient-provider relationship is so key to health outcomes. And there needs to be trust in that relationship, and it really shapes the experience of the patient and what behaviors they choose to take up or not. And I'm curious your take on how can we do as a physician, what is your perspective on building more trust in that relationship? Because that is a potential trusted messenger, sometimes not. So how do we shift that?
Yeah, I so appreciate that question, and I'll probably build on what my colleagues have suggested, but it starts with listening. And I think as a practitioner, just to give you an idea, we'd have a clinic day, and when within just a half day, we might see 15 or so patients. We might have 15 minutes with them, and it's so easy to get in the habit of just going into what you think is the issue and just start talking at someone. But whether it's at the bedside, in the clinic, or in the community, it's really important to start with listening and be curious. And I say be curious because that applies to everyone in this room and those who are tuning in. Because as we approach conversations like this, as we approach intersectionality that we all have, that's also why I mentioned I'm a father, I'm a husband, I'm a physician, because that intersectionality is the lens that I bring to the work that I do. And so it's really important that we are curious about one another. And similarly at the bedside, be curious about kind of the patient-physician relationship and the person you have in front of you. Leading with listening, I think, is really important. But what you heard my colleagues also say is you don't stop at listening. You continue to learning and then act. So you use what you've learned and listened to inform kind of the next steps. And that's how I think, you can have a very credible and reliable message, regardless of what you do, whether you're a physician or otherwise. But if you don't have the conduit to get that message to the destination, maybe it's the patient, maybe it's a person in the community, that conduit can be a trusted messenger, like you all said. And it can be the physician. Maybe the physician is the trusted messenger or it's someone else. But I think you have to identify those credible, those trusted conduits, those messengers that will carry that message forward. And that relates to community work as well. It's, all of us in this room may have good intentions in regards to a new effort or initiative or program we want to do. But if we don't partner in an effective way with that trusted messenger or messengers, then our reliable message will never get there and it won't be received in the way it's intended. That happens at the bedside.
Thank you for that. And that segues beautifully into the question for Dr. Fairley. Hi, Dr. Fairley, you're totally there. You've done so much work through the CDC to reach communities through communications campaigns in really thoughtful and creative ways, particularly those who may not always receive the most robust information around cancer, historically included in marginalized communities. And would love to hear your perspective on how communications practitioners have a role to play in creating not only the trusted messages, but reaching communities through trusted messengers, because you've done so much of that work directly. I think you're on mute.
Can you hear me now?
Yes.
Perfect. Okay. So I take it the camera's over there. But thank you so much for that question. As I was listening to Dr. Gray talk about, trusted messengers, that's probably one of the largest parts of the work in terms of messaging and making sure that the right message gets to the right people at the right time. And having the appropriate messenger, having the message delivered in the best way for the audience that you're trying to reach is key. So from a communications standpoint, I think, in the ideal world, we're allowed to do all kinds of formative research and testing to see, who in the community, understands what we've said, how they prefer to hear those messages, what have you. And that's definitely an ideal world where you have a nice size budget, right, to do that kind of work. I think that, when you start talking about community level communication, though, the messenger is everything. You know, if you're in a community where, if you're in a rural community and you may have a lot of migrant workers, or, you know, there may be some, you know, financial areas or issues or what have you, finding people in the community who can deliver that message is really at the top of one of the things that we have to think about. We can have great messages, and I've been a part of this before. It's a wonderful message, you know, like, this is great. We think it's great. And I'm speaking from the federal government, where we think we have it right, like the first time. You know, this is wonderful and great. And then you put it out there and it flops, right? And we really have to think about how serious that flop is, how serious that error is, right? Because we're talking about communicating risk. We're talking about helping people understand what they need to do to stay healthy, and knowing how to get that information to them is such a big deal. I think in the cancer world, we've tried to think as broadly at CDC, try to think as broadly as possible, right, about this. So, you know, we've tried everything from entertainment, education, including gaming, to, you know, doing ads, major ad campaigns, more targeted campaigns to specific populations and communities. We've tried a lot of different things, and we are really open and curious, as Dr. Gray said, about, you know, what's the best way to get this done. And that, I think that that's been the approach that we've had in trying to do some of this work. And it doesn't happen that way all the time, right? Yeah, I have to admit that, and from the federal perspective, it doesn't always happen that way. But I think that we really do try, and sometimes there are fails, and so we have to look at those fails and then regroup and try it again. So.
And Amira, can I add one thing?
Yes.
It just to piggyback on the beautiful words you shared, which failing and doing the work of connecting with community in a way that's meaningful, it takes time. And it takes that kind of investment and willingness to be present when you don't necessarily have an agenda or you're not on the agenda. And I think that's whether it's a physician trying to connect with patients or populations, or it's a researcher trying to connect with the population to conduct studies. You know, it's the best way to get a relationship is to be present. And it's so important that if we want to have meaningful connections with community, that we are there when we don't have an agenda, when we're not doing the study, when we're not trying to, you know, collect information or samples or any. We just show up. We show up to the basketball game. We show up to the, you know, to be present with the community for something that's meaningful to them, but it may have absolutely nothing to do with what we're doing.
It has to be reciprocal, right? A relationship, community with people, which is part of why we're all here today, in community to learn more together. I was thinking about terms because you mentioned terminology, and I think many people have heard the phrase social determinants of health. And any one of you who'd like to, I'd love to have sort of a high level, what are social determinants of health? And why does it matter for each of us? So all of us are patients at one point or another. So what are social determinants of health, and why should we each care about that phrase and what it means?
I'll start. The truth of the matter is, you know, 80% of our health and well-being is not dictated by what happens in the hospital or the clinic or the emergency department. It's largely what happens in homes and neighborhoods and communities where we spend most of our time. And it's usually those environmental and social factors that actually contribute the most to our health and well-being. And so as we think about that, let's put it, you started, Amira, you led off this conversation kind of talking about the pandemic. So let's go back a couple of years. We're near the 3-year anniversary. But if we take ourselves back to the beginning, we remember that one of the first narratives that came out was the highest number of cases, hospitalizations, and deaths was amongst people of color. And what was associated with that narrative is that, you know, these are populations who have higher burden of chronic diseases, diabetes, high blood pressure, cardiovascular disease, and the list goes on, which is true. But what was lost in that narrative were what are the root causes? What's contributing to that? And if we look further upstream, using my kind of public health parable there, moving further upstream, we see that it's the social determinants, the food insecurity, the economic instability, the digital divide. Speaking of patient-physician relationship, you'll recall that at the first wave of the pandemic, you couldn't get into your provider's office. You had to now use your phone, you had to use your laptop, your iPad to connect. But what about those people who didn't have broadband access? Or maybe they had broadband, but they didn't have the device. Or maybe they had the device, but they didn't know how to use that meaningfully to interact with their provider. I mean, all of these things contribute to why some populations may have better access and better outcomes than others. And certainly when we look further upstream, we know that there are other things that contribute to those social drivers of health. And that could be racism and poverty and others that contribute to that. So when we talk about social determinants, it's a lot of those things that are outside of what we do in clinical practice traditionally, but things that we should be doing in traditional clinical practice and in all of our work.
Like Dr. Gray mentioned, the word drivers as well as structural racism. So in my work, we often talk about the social and structural drivers of health outcomes, and structural racism being one of those drivers. And there's an allegory that we use to make that point clear. And it's called the allegory of the fish in the lake. I'm not sure if others have heard that. Where we start the question with, imagine that you're going on a walk and you pass by a lake and it's one fish dead in the lake. And I usually ask, what general question you ask yourself? Typically, it's not much concern. Someone may say, okay, what's wrong with the fish? I don't care, the fish is dead. What's wrong with the fish? But then you say it's the second day and you're passing by that same lake, same body of water, and a countless number of fish dead in the same body of water. And I ask, what question or questions would you ask yourself? And typically there's more alarm. Should I call? Is my water contaminated? What's going on with the lake? And then we take it a step further and we say, it's not just this lake, but it's every body of water in your area that looks like that second day countless number of fish, dead in the lake. And that's when we have to look at the impact of structural racism and the groundwater that's connecting all of those bodies of water. And we use the groundwater as that metaphor for structural racism. Mira, I quoted something from you saw on LinkedIn that health equity is everybody's business. Equity is everybody's business. We're talking about equity work. It isn't about just closing the gaps. It's about improving outcomes for all. And we can't just look at Edelman Lake or the Communication Lake or all the lakes we're representing, but how all of those lakes are interconnected. And when we talk about narrative, sometimes the dominant narrative is what's wrong with that fish, poor diet, don't care about their health, don't care about education, versus what's wrong with the lake, what's going on in the lake, that system that's creating those outcomes. And that connects back to what Dr. Brown said around increasing diversity in different areas. Why won't this particular demographic, why aren't they thriving here? Why can't we recruit from that demographic? We have to really look at the systems and structures. And it's not just about programs and services. So going beyond programs and services, which are needed, but really looking upstream and looking at change at the structural level.
Anything else?
Yeah. When I think about that in the way that I practice in organizations, I think about social determinants as, especially around COVID, as neglect and disinvestment in Black communities or communities of color that we have been forced to live with for generations. And the pandemic just really highlighted poor folks. And our narratives often dependent calls the individual as if it was, their contributions, not the larger system, and also to sort of flatten people as if we're all.
Dr. Fairley, anything you'd like to add to that? I want to give you a chance.
I had a moment where I was like, amen, Dr. Brown. I definitely agree. I think that getting to the heart of, what's leading what we see in social determinants of health. I think the other part of that is we have to look at what's happening in rural ecosystems, right? Where poverty is, very high, and we see that across races and ethnicities. And so how do we even think about that in some of the more rural areas? I'm from Mississippi, and I was having a conversation the other day with someone who took a job at the University of Mississippi, or Ole Miss, and they talked about the Delta So they had taken a ride, I guess, out to the Delta. And if you've ever been to the Mississippi Delta, it looks like time stopped in like 1965, right? And you can see just the poverty across the board. Likewise, if you go to parts of Appalachia, you'll see something that looks very similar. And it's the poverty, and it's people being disenfranchised. And then suddenly, when we see issues with drugs and what have you, we blame the people. But really, what we're seeing is this systemic disenfranchisement of people, and they may be people of color, they may not be, but there's a breakdown in the system somewhere that's contributing to this for, I think, all kinds of people.
Another question before we go to some Q&A, and we also have a signature question for this event series that I'm going to ask each of you. But on his first day in office, the president ordered that the full federal government root out inequity. And I'd love to hear from each of you, each either employing someone or an employee, an employer, and what is a practical program, example, or item you've seen where rooting out inequity has taken?
That long pause.
They're thinking, the people are
We're looking for it.
I can give it a try. And this probably isn't directly answering the question, but more on a broader level. Like, what are evidence-based tools? Like, what is an equity tool? What does it mean to apply an equity lens to a policy or program? So I think this is work that we're doing in government, but it can apply to any organization. How can we examine current and existing practices to do that rooting out? And there are key components to that. It starts with understanding what is the goal of this program or service or policy. The second part is what data do we have on the effectiveness of this? Who's most impacted? Are the data disaggregated by race, ethnicity, gender, ability, status, sexual orientation, other social identities? So that we understand the effectiveness of it. Also looking at resources, are the resources going to the right place? The third part of that tool is looking at stakeholders. For those who are the consumers of this health intervention or other program or service, what are they seeing about it? What's working? What's not working well? Who are other stakeholders that we can tap into? The fourth part of that, of this equity tool, is understanding who's benefiting and who's being burdened by it. So that analysis, what might be some unintended consequences? A term that we've been talking a lot about is targeted. So you may have a universal goal, but you may need a targeted strategy. Also, intent doesn't matter. Good intent can cause harm. Also want to mention that. And then finally, how are we going to track and measure our progress over time? And that should link back to the specific goals of that particular program, service, or policy. So that's something that I want to leave for you as you're thinking about what may be some existing policies within your respective organization to maybe root out some inequities, applying a similar tool.
And I'll add, there are some examples of how inequities have been rooted out. And, we also have to think broaden our definition of health. So for example, many companies have taken a stance that they want to make equal pay. That's rooting out inequity in pay. That is probably largely gender-based. Similarly, in organizations such as ours, we've looked at, advancement. Does everybody have an equal opportunity to advance? Looking at director positions and above, et cetera. That's kind of rooting out inequity. But I think to your point, the larger issue is that, every system is perfectly designed to get the results that it gets. Dr. Paul Bowden, I think, said that first. But that just means it should be no surprise when we see inequities. As we think about the health ecosystem, I don't necessarily think that the health ecosystem is broken. I think it's working as it was designed. And so if we want to root out inequity, we have to design for that. And I think about the great work that I get to do at Elevance Health. That's kind of what we do. Our strategy is a health equity by design strategy for us to achieve health equity. And we're not there yet. We haven't achieved health equity yet, as you all know. But what we've said, and where we draw our line in the sand is we're going to say that health equity is not a vertical, it's not a product, it's not something off to the side, it's not an initiative, but it's something that we make a horizontal across all of our lines of business. Everyone in our organization is responsible and accountable to delivering on it. We embed it into our processes, our practices, our programs, and it must be reflected in all that we do. And it's not just this off to the side program. And it's not just the responsibility of one chief health equity officer. Like was said, it's everyone's business. And that's how we will root out inequities.
The two things that I would offer that might be additive is a capacious analysis and the intersectionality. So, not, oftentimes we'll say, well, let's look at equity in housing as if there's not a prerequisite for housing. Let's look at equity in schools as if where you live is not a prerequisite for where you go to school, right? And so looking at it in the way that it is lived and intersectional and not in isolation. And then the other thing that I would add is changing the orientation. Oftentimes in organizations, they would say, well, how is diversity and equity showing up? Where is it on the agenda? Where is it in the program plans and governments? Like, where is it in the policy? But if we reoriented ourselves and think about how does racial equity inform the practices and the policy and not just where it shows up because it's performative and, the add-on and, so having a strong analysis and intersectional and how that's connected. And then how does that inform the work and not the other way around?
I'd like to jump in. Dr. Brown talked about the add-on, and that's one of the things that we see, or that at least that I'm seeing. I'll say it like that, and I'm careful because I'm here as the White House. Look, pause. Okay. We do see the add-on, and I think probably my greatest concern and thought about this is as we're writing policies and as we're thinking about how to do things that go forward, is that we actually have to remember that this is something that could, dare I say it, not be chic and not be in the next 2 years, 3 years, 4 years, 5 years. And so how do we write the narrative? How do we put things in place and build systems in a way where these things become just the way that we do it, right? And so all of the added, job titles and staff and things like that, that quite honestly could go away. And I especially think about this from a federal perspective. These are wonderful. I think we have a distinct amount of time, to kind of shoot the gap and get as much done as we possibly can. The one thing I'll say about being in federal service, and I've been in the Fed for a little over 20 years, is that one of the things that we saw with the Biden-Harris administration last summer was the acknowledgement that there were issues with inequity based on race and ethnicity in federal service. And many people in federal service have experienced it, have gone through all of the issues, but to have it acknowledged was a huge thing. But we need to go beyond the acknowledgement, right? And actually try to address as much of it as we can. But writing, and I think about it from a policy perspective, as we are writing policy and reports and thinking about standard operating procedures, we have to be really thoughtful about the fact that the political will to keep this moving could be shaky at any point. And so there has to be an interest and a commitment to sustainability beyond our reports, beyond all of our written policies that can be undone tomorrow. I think we have to really think about how to do these things in a way that's sustainable. And so the people in this room, who I can't see, I think that's something to definitely think about, is do we have the political will and the commitment to seeing this going forward in a sustainable way? And how do we approach that, right? Because things become trendy, and I hate to say that when we start talking about something as serious as equity, but this is kind of the way, I guess, everything operates, and so we want to really be thoughtful about that and acknowledge that truth.
Dr. Fairley, acknowledgement is the first step. We have to get to action. And with that, I'm going to open the floor for some questions from our audience, and then we're going to come back to our signature question that we'll end with from our speakers. But Jen, what questions do you have?
That's fabulous. I have the mic on. I hope everyone can hear me okay, but I wanted to share a question that we got via our Zoom chat from our online participants. And so here's their response. And this is kind of directed at everyone, so feel free to jump in and answer. So they said, this is such a powerful panel. Thank you for being here. What are your thoughts on the affirmative action conversations and the narrative that is dividing East Asian people from Black and Hispanic people? How should employers and CEOs address this internally? Yeah, a little bit to think about that. That's a big question. So anyone who would like to answer, feel free, but that's something that we got from one of our online participants.
Yeah, I worked in a system where that was a challenge, right? This sort of divide and conquer, strategy. We had to, really think about and, get people to reimagine that there was enough for everyone. It wasn't a zero-sum game. And I like your, race explicit, but not exclusive. I mean, we can do that in, racial categories as well, like Black explicit, but not exclusive. And really understanding that if you solve for the most impacted, then you solve for everyone. Right. And so moving people from playing like a Russian Olympic to thinking about, we're all in the championship together and, getting your analysis right on who is the most impacted and working from there. And, create a culture where it's not tolerated, right, within organizations and, remove the things that contribute to that sort of outcome and or behavior.
Related to that, going back to that fish and lake allegory, I did not create that, so I do want to give credit to the Racial Equity Institute out of North Carolina was done work on that. So I want to mention of that. But the fish that were dead, we know that when it comes to people of color were disproportionately impacted, but there are other fish swimming and living in that lake. So we clean out that lake, it's going to improve the lives for everyone. So we all have a stake in the game.
I will say just, I cover a wide variety of businesses, and a new report that I wrote about today has shown that, the vast majority of like S&P companies are now publishing their diversity stats, which is a really, really encouraging trend. And to the concern of, is this going to be chic? I will say consumers are demanding this, even if political winds change. Younger generations are not afraid to vote with their dollars in their pocketbooks and boycott companies and call them out. And so I'm encouraged by that, and that they will hold all of us accountable because they won't tolerate it. And to the question specifically, I mean, a lot of people have, over the past couple of years, had lots of internal soul searching about their own, anti-Blackness. I know that's been a big conversation in the community that I'm part of. And so I just think people are, they're confronting all of these things that they've been shying away from because they didn't have tools, they didn't have the language, they didn't know how to talk about these things. It was not discussed with families. And, the model minority myth is one that was actually, designed to pit different people of color against each other and say, in the 60s, well, look at the Japanese population, like they're here and they're doing great. And what, that stuff was fed to us, and it created this foundation for the oppression Olympics and for the table that's only the size, instead of thinking about just building a bigger table. And so, I'm not going to speak for everybody who look like me and is, from that part of the world by ancestry. But I will say that, I'm deeply encouraged by the individual accountability that I see amongst my friends, amongst my peers. And, we're talking about this and we've never talked about it before, in our friend groups. And so, that's what keeps me going. My name is Hope for, I'm probably one of the few optimists in my profession of cynics. All journalists, after a while you see so much of this stuff and you get really down. But I truly believe in individual empowerment, in reminding people that they have autonomy over the way they feel, how they interact with everybody. And so that's sort of how I live. I try to infuse my stories in my own ways to remind people of that.
Wonderful. Thank you guys so much for all the answers, the very insightful answers to this question. And I actually have another question and then another one after that. So my next question is from another one of the attendees in our virtual audiences. And this is kind of how they wrote it. This is a question, and shout out to Hope King. Hey, Hope. Thanks again for the trust in our work and for your incredible reporting. Since a reporter's biggest assets is their incredible sources or credible sources, what would be the best way to cultivate a relationship with a news source, for example, spokespeople, in your opinion, that may be representative of marginalized communities, but may not be well known widely in mainstream media?
Well, thank you for the shout out and the question. I've spoken internally with those Edelman folks, so I think maybe that this is coming. But I have been pretty public with everybody that I work with in the PR world that I prioritize women of color in my story. Everybody who just reads all day and talks to lots of folks, I've noticed patterns where I'm speaking to a certain person repeatedly and or I'm seeing the same kinds of names in other stories. And so when I request or when I get requested both ways, I always ask for a person of color first. If it's somebody who's not trained, I say it's fine, give me somebody who's more junior. Like, I don't care about titles. CEOs are wonderful and they have important jobs, but they don't always give you the most interesting thing. They've been trained so much. So the best way to develop that relationship, hopefully you get reporters who are like me who think that way. I know that I take extra steps and take the extra time in order to correct some of the inequities, even in showcasing talents and expert voices. And I would just encourage anybody who has, clients to look deeper in your Rolodex. Everything just takes a little more time. It's annoying, or it's like an extra step, but it goes such a long way because it compounds.
Thank you so much, Hope. And then I will move on to my last question from our virtual audience, and then we'll open it up to our in-person attendees. But the last question is, or it's phrased as, a question for all. How do we help marginalized community allies understand that the work on DE&I is not on the diverse people, but rather a collective effort? Guys, choose who wants to go first and answer that one. Thank you so much.
I think there was a theme around sort of naming it. So if you acknowledge it or name it, then you can build some shared understanding of what you're working towards, or at least against. And believing it, right? Believing the stories. Like, oftentimes, people of color and women in particular, women of color in particular, have to, retell their story over and over and over again, like convincing people that this was the, experience, and then, taking action, again, collective action. When there's the need, and there's always the need.
I would say be accountable. And for those of you who are in leadership positions, build in that accountability in the workplace and in your work streams. And if you want to be an ally, build that into your success metrics. So build that into your incentive plans so that everyone has skin in the game, because it takes everybody. It's everybody's business.
I'll just add one thing around the importance of doing the work, the internal work.
Mhm.
I think the question alluded to that a little bit. I think allyship are critical pieces, but the word itself or the title that we may give ourselves may not be what is exuded in practice, or the importance of really knowing who we are, understanding our own socialization experiences, our own identities, and how just our awareness of that. But I don't want to downplay that piece.
Very important.
I think that, you know,
Dr. Fairley.
I was saying, you know, one of the things I always think about is how do you teach adults empathy, right?
Oh, yeah.
Because at the end, right, I haven't figured it out yet, but really what you're talking about at the end of the day is that ability to put yourself, even this thought or consideration, to put yourself in someone else's shoes. And I think that that's a challenge for a lot of people. And if you've grown up, you know, privileged or what have you, it's hard to even think that way. But I think being curious about that and about how to do that, I think is a huge step, you know. And it's okay when you don't know, you know, it's like be curious and ask. You know, there's sometimes where asking makes sense, especially when you're in positions of authority. Ask, right? It's okay to not know, but ask what are some of the needs of your, you know, the people who work for you and who work with you. You can't acknowledge anything until you know that it's an actual issue. So.
I like the thing around empathy and, you know, building a practice and a spirit of empathy where you can replace empathy with judgment and anger. Because when you have judgment and anger, you're likely going to be wrong, or you're going to create an experience that you can never fully recover from.
I think the visual you gave us of the lake is, we all have different capacity and ability. And I think the fish on the east end of the lake have less toxic water than the fish on the west end. There's an onus. The fish over here who are healthier have more supports and ability to help root out. Maybe those fish have legs and buckets. I don't know, we're drawing a new picture, but I think to the question that was asked is, there are some of us who have different supports and resources that others don't, and the onus is on those who have those supports, resources, and capacity to do some more of that sweat equity. Now we're going to open it up to questions here from our audience, and Kim has the mic, so just raise your hand and we will come find you.
So on to like using this fish, and I like fish or so, but like using this fish analogy, I think it's interesting and thinking about trends and everything like that. I think a lot of the time we're maybe used to seeing that, right? There is a numbness to disparities, inequities, seeing people not thrive in their environment. And I think it's good. We expect it, as I said. So I'm thinking of, let's say, for COVID, we illuminated briefly housing inequity, or all these other things that are those social determinants of health that are causing or facilitating kind of these disparities. Or even a couple weeks ago, the hormone-related cancers associated with hair products, right? A brief kind of flash, you know, we saw some news articles about it, but then nothing, we haven't heard anything since. And so I guess I'm questioning, how can we dismantle the numbness so it's not the flash in the pan, but it's sustained engagement that's carried by the majority rather than kind of a couple of individuals and then kind of simmers down and disappears. A big question, but curious what your perspectives are from your fields.
Something I was thinking about just from the last question, you know, about how do we teach adults empathy? You know, Dr. Fairley, I mean, I think about this a lot because the obvious answer is like everyone showing up, you know, like seeing people in the room today, you know, seeing who's in the room today, like that's encouraging. And because opted to spend your time here, not everyone does. And, you know, just going back to my, my soapbox of, you know, individual accountability. I mean, we all have the ability to bridge this very divisive country if we put ourselves in positions of discomfort. Let's sacrifice a little bit of that, comfort for someone else and see what happens. And I think everyone should be in therapy. I mean, you go in and you encounter people and you realize I have so much in common with this person. I'm in group therapy, so this is where it's coming from. But I may have had a judgment about the person had I not actually had this conversation with him over months, years. That creates the empathy. But it's because I put myself out there. It's because he's putting himself out there. And so something that I would love everyone always to do is just to continue to put yourself in uncomfortable situations, because then you're extending yourself. You look around and you're saying, hey, I only hang out with these kinds of people all the time. Like, maybe I should go and hang out with somebody else. Just being aware of that, my own feeds on social media. If I really dislike something, don't unfollow. I keep it on my feed so that I'm constantly reminded, there are these people out there and that I'm not in my own silo. I think I lost the point of the question, but I definitely want to say that, seeing everyone here just makes me feel, happy that people care enough. And I think if we go just a little bit more, it'll go a long way, and that'll action.
And what I encourage you to say home to the point of the question is, how do we keep it top of mind for people, is the way you curate information in your world and the way you curate the relationships around you is when you are experiencing the lived experience of those that you love and fellowship and are in community with. There's so much that's top of mind in terms of what they're experiencing and the inequities that they may be facing head on. So some of it is about relationship, being in relationship with people unlike you, and your information sources, curating what you're seeing and reading and hearing. Abby at the front here.
This is to all of you guys. But also,
Abby, you want the mic?
I can probably move.
Okay.
All of you guys, but also Dr. Fairley, who's in the White House. We're in the middle of the midterms. They're in a week. Everybody's stressed out no matter what side of the aisle you're on. How do you guys keep going no matter the outcome? Because you made a comment. Actually, we all talked about how we don't want, this can't be a flash in the pan. Too important no matter what your background is. But it's really heavy stuff, or it can be. How do you guys keep going?
I try to practice and encourage others to find their individual and collective joy and peace in this moment, in the foreseeable future, and enjoy the heck out of it, right? And also being reminded that our ancestors did, so we're built for this.
I think, we all can make a choice each and every day, every meeting we go into, whether we feel like it or not, to enter it with joy and curiosity. And I think for me, speaking personally, that helps me a lot. It's just continuing to be curious about problems, about solutions, and entering the opportunities to interact with others who may be on one side of the social innovation curve as opposed to the other, or may think totally different than me, is to leave with that joy and that curiosity. The other thing is that this work is very personal. So, at my introduction, I mentioned the many domains that kind of make me who I am. And one of those is being a father. I don't want my kids and their kids to encounter the same issues that I've encountered, whether it's training or in my career, and then even, beyond that. So it's very personal. And so that's how I keep going, is I connected to that. And it's also, I find, like you said, find your place of peace. And I find it in my faith. So that's how I keep going.
Similar to what else has been shared, this is purpose for me, not just the work of distant ancestors, but my parents who are both deceased. So in a way, this is an extension of their work and their activism. Who they came of age from the civil rights movement and hearing their stories. So in some ways, it's a legacy. But also another thing that we talked about are how systems work, and systems are designed to maintain the status quo. And this is change work. So if I'm not there, then that that causes me stress. At the same time, I talk a lot about the opportunity, the other hat that I wear, that gives me opportunity. We know wrongs that have been made by various organizations and institutions. I'm in an institution, I have the opportunity to help create change. That excites me.
Oh, they went fast. I saw your question. That wasn't that way.
So Dr. View, this is a question for you. So we've talked a lot about, I would probably categorize as earning trust with communities. But one thing you said a few times is leveraging strength and working with communities. How would you describe, like, how do you go about identifying those strengths? And if I could ask, particularly among people who are different than you.
I think it goes back to what Dr. Gray said around listening and showing up and not learning the answer to that question when you need something. So we're going through, there are processes within government where you're getting information about a proposal. So not just being in community or in a community when you need that, but establishing sort of long and inclusive presence. You're able to leverage that relationship. So I think that's one way, but also going back to empathy, another related term is perspective taking. So being able to take, engaging in that community, listening and understanding the lived experiences, and from that sort of learning what some of those inherent strengths are, but also having a strengths-based perspective, I think is key. Just having that lens itself, I think, will facilitate the answer to your question.
All right. Is there another question?
Go ahead.
Can I jump in on that one? Sure. No, I'm a part of this group that is about racial reconciliation. And we are in this group and in this room, oftentimes being uncomfortable. I mean, it's painful sometimes and it's just uncomfortable. And I think that the reality is having to do some of this work is the acknowledgement that it is uncomfortable, to not expect it to all be, or to suddenly be, this, dare I say, kumbaya. Like it takes work and it takes time, but there's going to be discomfort, right? And I think we have to just be honest about that so that when discomfort shows up, we're like, oh yeah, this will be uncomfortable.
I often say to leaders that I work with that and warn them, this is going to be ragged. And you have to be okay with raggedy and have a raggedy leader that we just sort of work through. And, if people are okay, are okay because it's taken 500 years to bake in our system of inequities and injustice. Corporate commitment statement in 2020, not automatically going to turn.
I appreciate the comments you made about technology, health technology, and the challenges we saw during the pandemic with access. And we're having a really interesting conversation with many organizations we're working with in the health communication side in looking at, where does health tech play when we're looking at possible future solutions and taking down some of those access barriers. And specifically when companies are looking at, different initiatives they can put in place related to health equity and access. And then we look at the relationship between the provider and the technology. And patients are clearly saying, I don't want to go back to before if I had access to technology, but I still want to see my provider and I want to have that relationship. So it's opening up really interesting conversations, and a number of organizations are saying, how can we find examples of what is working, but also ways that we can put technology in place to help enable and improve that access and not just reinforce the barriers we're seeing. And I wonder if you or anyone else on the panel might have either things you've seen that are working or ideas that you think we should be putting in place for principals to make sure this actually is put in place to make a difference.
Yeah, great question, great points. So, one of the kind of, and I was in a conversation with a colleague and friend, Dr. Lisa Fitzpatrick, who leads an organization called Grapevine Health. And as we were talking, she was saying that, and I'll borrow her words, these are not my own. But she was suggesting that there's some myths behind the digital divide. So as I mentioned the digital divide earlier when I mentioned there are people who don't have a broadband, there are people who don't have a device, there are people who don't know how to meaningfully use their device, which is all true. But there are, if you were to go out in LA or go out into DC and you find someone who's homeless, you might assume that they don't have a way to communicate, but they do. Even those people who are homeless or poor, they have smartphones. And I think one of the points she was making is, it's not that people don't have ways to communicate. It's that we as kind of trying to be the trusted messengers or the health communicators, we need to get messages to people in a way that resonates with them, that is culturally responsive, that is relevant, and that is reliable. And I think that's in some ways where we as a health ecosystem have failed. And I think the opportunity is to, as we are kind of, and I'm just saying we kind of global we, as we are solutioning in our ivory towers, we have to kind of come out of our ivory towers and go into the community, or bring the community into us as we solution. Because that's how we'll find the solutions that actually meet the needs in a way that resonates, in the way that they will adopt. Particularly as we think about those who have been made vulnerable by systemic equity, it's how can we do it in a way that resonates with them and they feel like they've got buy-in and they've got skin into the solution. Because to your point, if we look, I mean, even just over the past couple of years, just the amount of health tech that has come out, it's amazing. It's needed. I think about what's happening in the behavioral health space with health tech, happening in maternal health space. It's great. It's fantastic. But there are many populations where it's not reaching the audience because they don't feel like they have skin in the game. They don't feel like it's made for them. Yeah.
Yeah. I would say my first thing, and we talk about this a lot, is broadband. Can we get to a point where everyone has access, right, in terms of broadband? But and that was just a plug from the White House. But I think about, for example, today FDA had, I think it was today or yesterday, FDA had the advisory, one of the advisory committee meetings talking about, this issue with pulse oximeters, right? And the inequity based on, the fact that the pulse oximeter may not be able to read, right, accurately, the oxygen levels for people of color, right? And this was a huge issue during COVID. I think that sometimes the tech is not quite where we need it to be. And sometimes we have all of these new advancements in tech, but maybe the healthcare providers, it just blinked. Are you guys still there?
Yes.
Okay. The screen just went black. But I think that there's another part of this, and Dr. Gray, forgive me for going down this road of healthcare providers. But I think sometimes, that sometimes there are limits with the tech, and it's not just from the patient perspective. Sometimes it's from the provider perspective and provider access, or providers being located in places having the capacity to use certain kinds of tech with certain communities. And so I think that's one of the other things that we have to address, right? So, if your provider is at said Title 10 clinic, right, and they may not have access to some of these resources, or if your person is coming from who may be homeless but has access to the devices but doesn't have enough bandwidth or access in that way to actually use their phone for some of these services. I think that there are some major hurdles that we have to cross, with providers as well as with making sure that people have access to the resources.
Dr. Farrelly, I am going to move us to wrapping because we're going to respect the time and talent of our wonderful speakers. Thank you all for being here. And our signature question, many events or podcasts do this. They can be personal, professional, and it can be a one-word answer, but subtraction can be additive. So what are you thinking about subtracting this year that will add value, either in your role or to the world? Dr. Gray?
it kind of goes back to being present. And I think, many of us in this room, well, I'll just speak for myself because I don't put myself on other people, but we become very skilled at multitasking. And whether it's, project that is geared towards diversity, equity, inclusion, health equity, or otherwise. And what I'm looking forward to doing more and more and more is to just be here now, meaning every interaction that I'm in, I am present with that person. I'm not thinking about my cell phone. I'm not thinking about the next email I need to send. I am not thinking about the next meeting that's happening on the exactly the half hour for, in the Zoom culture we're in. But I'm present with the individual. I'm present with whoever I'm with. So I'm looking forward to subtracting the kind of all the multitasking and being present in every situation. Yeah.
I can go. I think I want to, this is going to be difficult, take away a false sense of urgency, which I think is very pervasive in our culture. It's also sort of the opposite of what we mean by, equity work. And I hope that subtraction will add to what Dr. Brown said in giving me or opening up more opportunities to experience joy.
I'm thinking about the subtraction of doubt with adding curiosity.
I think similar to Dr. Gray, I told my boss this, so I can say this, but I'm attempting to quiet quit this year. Because I'll text my best friend and just say, well, how was your day? And I said, well, I did a hit on MSNBC, and then I was writing 4 stories, and then I went to an event, and then I went to the gym, and I get to think about all the things that I do and I put on myself because I feel like I need to. So this is obviously very personal to me. So I think I could definitely benefit from just doing less and just, to quiet quit it. So that's my subtraction.
Thank you, Dr. Fairley.
Yes, I think I will join Dr. Brown in the doubt part and not. It's hard to not get to that place where you doubt that change is going to happen. And I'm not sure, Dr. Brown, if that's the road you were going down.
Yes.
But it's kind of to try to hold on to hope. Yes, hope. Try to hold on to hope and not and not let the doubt based on what we've seen, experienced, and how long we've kind of been in the battle. I'm sorry, battle's the right word. How long we've kind of been in this work to, make us doubt, whether or not we're going to actually see movement and sustainability.
Thank you for each of you being here, each of our informed guides for your wisdom. And I heard 3 things. There's work that has to be done individually, our own biases, our own learning and journey. Interpersonally, how we build relationships and connect with those around us. There's work to be done there. And institutionally, there's systemic change, organizational architecture that has to happen. We have to upend the systems that are maintaining that status quo to actually advance equity. So thank you for your insights, for being with us, Dr. Fairley online. To our virtual audience, we appreciate you all being here. And also I want to say thank you to the team that made this happen. Our health leadership team, Bruce, Abby, and Courtney, who you see here, who supported this event, and Margot, Jen, Consti, and Kim, who are our boots on the ground team. I was out for quite a while, several weeks, and this team stepped up and in to make this event happen, and it wouldn't be possible. And our tech team and the facilities team who stayed after to be here with us. Thank you all for making this possible. And with that, we appreciate everyone's time and energy, and we will follow up this event with an Edelman Insights piece. Our DEI and health equity practitioners are going to weigh in on the conversation we have here and tie it back to those actionable and measurable tactics that businesses and organizations can and need to be advancing And that's at edelman.com. So be sure to check it out. We'll send it to you all. We have your info now, so we'll email that insight space to you. Thank you for being with us.
Great sharing.